special meeting for the Board of County Commissioners to order for Monday, November 23rd. Let the record reflect that we have all three commissioners present. And are we ready to go? So, Commissioner Kearns, I will give you a heads up. I might have to step out here this morning for about 5 minutes to take a call. So when I do, if you would continue on with the meeting, that would be much appreciated.
No problem.
Thank you, sir. First item of business is we're going to do some CARES funding. So, Miss Griddle, are you with us? There you are, dear.
Yes, I'm here this morning.
Thank you. And so our first presenter is Lori Ensler for Spokane County Fire District 2. Are you with us? I don't see you.
I see that Tom with Fire District 3 is on.
Yeah, and I see Cody. Welcome, Cody. How you doing, sir?
Good morning. Good to see everyone.
Yes, is there anybody from Fire District 2 on the line? Not seeing anybody. Well, why don't we go ahead and deal with Fire District 3, and then we can always come back to 2 when they get on board. So, Tom Lunkin, are you on? Tom, are you with us?
I don't know if you can hear Tim or not. He is across the hallway from me.
Good morning. Yes, I am with you now.
There we go. Might have had a mute button.
Very good. So the floor is yours, sir.
Want me to kick off, Tim?
Absolutely.
Okay. So for Fire District 3, we broke our request into 5 broad categories. I think what I'll do is start kind of high level, walk you through it. Certainly stop at any point if you want additional clarification. We also have paramedic Tim Lonkin on as well if we need a little more technical expertise to explain things. But request number 1, pretty self-explanatory, as you can imagine with the current circumstances. We're going through a lot of PPE, try and keep our responders safe and the public safe. So that's just a combination of gloves and masks and those types of things we're really burning through quickly currently. Request 2 is CPAP, or continuous positive airway pressure with Viromax filters. So why is that important, and what's the connection? The CPAP is a type of breathing treatment. As you can imagine, that's pretty important with COVID. A lot of our calls for COVID-related symptoms and calls go out as difficulty breathing. The difference with this CPAP is it's an enclosed system, meaning that it doesn't aerosolize when used on a patient, as compared to what we currently utilize for CPAP in the district is an aerosolized system, meaning that it puts potential virus into the air. And so that's really to help protect our responders with patient care. Request number 3 is related to video laryngoscopes. That's also tied to the ability to place airways, which becomes important with the difficulty breathing associated with COVID-19. That's primarily a paramedic skill. So that go to my page. That's under request 3 to include, and just 4 of those for our paramedics, for a total about 10,000 on that. As it relates to difficulty breathing and airway management, the ability to breathe, if patients deteriorate from that point, it often leads to cardiac arrest. So that's a good segue into request number 4, which is automatic external defibrillators, or AEDs. District had in budget last year for roughly 21% of what it would take to to outfit the entire district. Given the current circumstances, we feel that's an immediate need purchase for COVID-19. So our request reflects the remaining budgetary amount where Fire District 3 would come in and pay for the 21% of those AEDs to outfit our entire fleet, ensure we had those available for response, and then the request picks up the remainder. And finally, request number 5 is the ability to practice all these new skill sets for our responders. One thing that we're really challenged with right now is the ability to do our what we call OTEP, which is our ongoing training and evaluation program. The inability to meet or come together has challenged us, and the ability to practice those skills they need when they're with patients is also pretty critical. The SimMan we have requested would allow them to practice all the airway management, the AED management, IV management, essentially those items that go along with our request. So that's to help ensure that our responders are up to the task and their skills are at a high level for dealing with patients. So all these 5 requests are kind of interconnected, interrelated. We felt they were directly related to current circumstances. The items you see were not in budget. If portions of the items were in budget, we calculated that amount, and the district will pick up that amount. At that, I would probably hand it over to Tim to see if he had anything additional to add.
Well, I think it was explained well on the paramedic level. I think that obviously with COVID, we're concerned with the breathing problems and what's associated with that and what's to come. If you have any questions, I'd certainly entertain answering them.
Any questions, either Commissioner Kearns or Commissioner Cooney?
No, I guess I'd just comment that, we're kind of getting the rest of the fire districts in, and I think it's a good use of our CARES dollars to make sure that they're protected and the people that they're working on are protected. And so, so thank you for all you guys do, because I know it's been, tough on you guys as well.
You're welcome. It's been pretty unique circumstances. We're trying to make the most of the circumstances.
Okay, so with that then, I'm open to a motion.
Mr. Chair, I move to approve and authorize the expenditure of CARES dollars up to the amount of $123,000 to facilitate the COVID-related expenses as presented by Spokane County Fire District 3.
I'll second that.
Okay, we've got a motion and a second. Any more discussion? Seeing none, all in favor say aye.
Aye.
Aye, let the record reflect motion passed unanimously. Thank you. Thank you, Cody, and the crew for all you're doing out there. Keep safe.
All right, thank you very much. We appreciate the support.
You bet.
Thank you.
You bet. All right, so then moving on to, I don't see Lori Ensler joining us yet. Carrie, do you feel comfortable?
I'm here.
Oh, are you there?
I am. This is Lori.
Are you, you must be on by phone then.
Yes, I am. Sorry, I'm
Okay.
at work. I don't have anything on my computer.
No, that's okay. So the floor is yours. You want to describe your request?
Well, we are requesting to purchase a new LifePak monitor because the one that we have is very old, and we need another AED that goes on that. And then we would like to purchase a Lucas automated CPR device because we're so far away from the hospital. We have a limited number of responders. So if we have to do CPR, it would help us a ton to have the Lucas device. And then we also need to purchase as many of the iGel airway devices as we can for intubating patients who are in severe respiratory distress, due to COVID-19 or something else. And then we also need to purchase enough PPE and personal ventilators just to keep all of our responders and our patients safe just in case we do have an increase in COVID-19 patients. So we're requesting $51,180 to purchase all this to help us in our response with the COVID-19 public health emergency.
Okay, thank you. Any questions?
I can't think of any questions.
Okay, how about my fellow commissioners? All right, so the chair's open to a motion.
Okay. The total was 51 and some change?
51,180.3.
Yeah.
Okay. Okay, I don't see it on the screen here. Oh, but okay, Mr. Chair, move to approve and authorize up to there we are, $51,200 to facilitate the COVID-related expenses as presented by Fire District 2.
I will second that.
Okay, I've got a motion second. Any more discussion? Seeing none, all in favor say aye.
Aye.
Aye, let the record reflect the motion passed unanimously. Mr. Gimmel.
Carrie, I'm going to assume that all of these that are on our list, you've already taken a look at.
What was that?
I said all these that are on the commissioner's list that we're looking at today, you passed your sniff test for eligibility, correct?
I think so, yes.
I'm talking to Carrie.
Oh, sorry. It's so hard to hear on this phone.
Yes, that's correct, Jerry. I've
Thanks.
reviewed all of them.
Thank you.
Yeah, Carrie actually prepares the list.
Yeah, I know.
Yeah, so, all right, so then, Fire District 5. Ms. Brown? Are you with us? Fire District 5. Okay. We'll come back to that. Then, Fire District 10, Mr. Johnson.
Hello, how are you guys doing today?
Good.
That's great to hear.
Do you want to describe your request for us?
Yep, you guys see it there on the screen?
Right?
Okay, so I'll start off with the first one, the acquisition of equipment. Just like many other agencies, we are burning through equipment, PPE, supplies that protect our personnel rapidly. And so we have had quite a few expenditures on that, and we will continue to see that. And so we're requesting item 1 of $10,000 to help reimburse that. The second item is our airway bags, and those bags are currently that we have, they can absorb moisture from a call. So anything that we walk into a house, it picks up on the bags, and you need to decon them. It's often we get vomit on them and blood. And so what we're looking at is switching over to a bag that you can wipe clean, and utilizing those on every single vehicle. And so that means that we'd be putting, around 25 to 30 out of service, and then adding a few more bags to additional vehicles. Request number 3. Do you have any questions on request 2?
Nope, not yet.
Okay. And request 3, the auto CPR devices. That is something that departments are starting to utilize to reduce the amount of exposure to the patient. Because when we go in, we don't know whether they're, unless they have a positive situation and they're reporting that to us, we really don't know what we're walking into. And so we have to treat every single patient as if they are positive. And so having something like this, it keeps the staff out of the face of the patient. And so and it's also anticipated that the call volume is going to increase with full arrest. There's studies out there that indicate that some countries were seeing a 60% increase in full arrest during this time when they had major breakouts in their communities. So with manpower being spread out and having the reduced ability with staffing, just if there's more calls, they would really help to have that. I don't know if you guys have ever seen one in practice, but they are definitely handy and very effective too. Any questions there?
Nope.
Okay. Request number 4 has to deal with the automatic defibrillators. We currently have some of our trucks that have defibrillators. What we're looking at is expanding that and to include our command rigs. That way we have more options while we're responding out there. And again, with if we really are looking at an increased call load, then resources are going to be slim. Okay, any questions there?
Nope.
Okay, request number 5. Okay, so this item here is it's basically a type 1 ambulance, and what that is a unit that has the capability of doing several different things. One, the Spokane County chiefs got together early on in the pandemic and started reporting back to what the other departments were seeing in impacted areas. And they were stating that, resources were spread thin. And so one of the things that the chiefs came up with is standing up an additional unit around the different areas. So like Valley would stand up 1 or 2 extra units. District 9 would stand up extra units. And then on the West Plains, we stated that we would stand up an extra unit. So this unit could be utilized for that. The other thing that it could be very effective for is Department of Health. A few months ago, I talked with one of their leads that was starting to plan for vaccinations. And they asked if we'd be interested in assisting with the vaccinations in distribution, if that was something that we'd be willing to participate in. And I told them absolutely. They had indicated that the West Plains was didn't have any type of clinic out here on the West Plains. Well, in Airway Heights area, there is some out in Cheney. So they needed some assistance out here, and that's why they called us. So do you have any questions on request 5?
I do.
Yep, go ahead, Mary.
So we have not seen this from any of the fire departments, this request, and I guess I'm concerned about that, just, because I think if we're doing vaccinations and all of that, that they're talking about kind of a set place. It's not an ambulance that's doing it. It's more of a clinic type environment. And so, not having, done this with the, looked at this with all the others, I'm not sure where I'm at on this one. So I'm just saying that out loud, that just because I'm not sure, the real COVID need for this, because again, a vaccination clinic is going to need to be something where it's a tent, people can come through, or, kind of the community center type thing. So, so this one I'm just not so sure of. So any other thoughts on that?
Well, I had a question. Would you be able to acquire that that ambulance by December 30th?
Yeah, so that's a good question. And, there's a possibility that, there may be a demo available out there or something used that we could do, but in all likelihood, probably not. It's too short of a timeline. So this is something that, even if it was approved, we may not be able to do with it. So we thought of alternatives, if, and where this idea came from is I deployed during Hurricane Rita, and they handed us our ambulance unit, boxes of vaccination, sent us out to a location, and we sat there all day long as people drove up for vaccinations. We were giving, I believe it was tetanus shots because of the amount of hurricane damage. And so that's where this, came from. and this idea of doing this. We do have alternatives. You know, we can run it right out of the station. If firefighters involved, you know, like Mary was saying, if they run it out of the clinics, then fire departments wouldn't be involved with that. And so that's why I was talking about a multi-role use vehicle. And I understand that, you know, if this is something that, you know, is outside the scope of the funding, then, you know, it's just that then.
Yeah, so my concern is, you know, one, getting the equipment here in place. The other part of it is, you know, coordination through the health district and setting up another site. It really needs to be coordinated through them and stuff. So I'm not sure that this is actually ready for prime time. So, but let's go ahead and let's finish out the rest of your application.
Okay. Then the next item we listed down was Life Pack 15. This item, basically how it relates to COVID is having the ability to put your monitoring capabilities on the patient and stand away from the patient, maximizing your distance away from them. You know, this is something that also has an AED built into it. And it kind of went along with having standing up an extra unit to deploy. This would be able to go on that unit and have that capability with that crew that in the chief's plan that we put together early on was that unit would respond just to COVID calls to lighten the load of the engine companies. And so this piece of equipment would be identified for and available for that vehicle. And so getting in the specifics of it, you know, some of the things that has the capability of is has the AED. It can do EKGs, 12 leads. They can do, you know, monitor oxygen levels and monitor temperature as well as your blood pressure. And all that can be done at a distance where once it's hooked up, they could step back from the patient and continue the exam and treatment.
Less chance of cross-contamination.
So any questions on 6?
No.
Okay. And I think there's one more, 7. And this one relates to training. Due to the COVID restrictions on the West Plains here, we don't have any ability to train inside of a facility unless we travel to other agencies. The recruit class that we had going was supposed to travel to Hammer facility, which is in the Tri-Cities. And they would have completed their training there, but we had to cancel that. And as facilities shut down and restrictions apply, having us to be able to put something together, you know, this is another one of those items that has been we've been discussing. We already ordered the boxes anyway. To initiate this, we were just wondering if this would be able to be reimbursed.
Okay, Gary?
On 7.
Gary, what are your thoughts about that?
Well, you know, being priorly purchased, I don't think takes it outside. It's really related to the purpose, if it's to protect people due to the COVID, if they can't train outside the county. And this would allow them to obtain their training, but for COVID. I mean, you look at both sides of this. If it was priorly purchased and they were going to do it regardless, then probably not. If it was being purchased because of COVID, because of not being able to train outside, then yes. So Ken, I would pose that question back to you.
Okay. So early on in March when this originally locked down, when things originally locked down is when this idea was originally talked about. And so, what are we going to do? Because other agencies, like I believe it's Spokane, that's still under, they just can't use their facility. And so going out and finishing up our training and sending people out, that's when this became an issue. So we knew we had to do something, and whether it was, just a temporary or a mobile unit that we could purchase, rent, and we tested that out with District 4, rented one of their mobile units, and it helped out. People liked it, but it's definitely, something that has to be shared. And so that had to go back to them, over the winter months, and plus it's on a semi-trailer. So having something on the West Plains would be helpful, not only to, our department, but Everett Heights Fire Department as well.
So Ken, the reason why you priorly purchased it was because of COVID.
Yeah, that's what initiated the conversations, and correct.
So in answer to your question, Commissioner, then yes, it would qualify.
Okay. Any other questions, either Mary or Josh? Mary?
Yeah, so one question is like on this, Fire 3, they had the simulator, is included in this, or is this just like I guess I'm trying to understand what it is exactly. You said it was on a semi-trailer?
Oh, yeah, that's a good question. So after I'm looking at this, so what this is for to continue and finish up firefighter training. So, with the firefighters going in and burning inside of a building, that's what that is. And so you put together these Connex boxes that are from the shipping containers, basically, and you stack a few together, and people can throw ladders. You cut a few holes in them and have windows, and you can burn pallets in there and simulate fires. And so that would allow us to continue our training with our new personnel, because we do have attrition. Right now we have 3 of our personnel out from COVID, and so the training gets impacted by that, and then sending people home that potentially were exposed. So it makes it much more difficult. And then if you're going to travel, we just canceled our plans to Hammer because it's not reasonable for us to plan that right now when the caseload is so high.
With some of the restrictions of 5 to 6 people in a group, that also has made it difficult on trying to do lump sum trainings at other towers on the weekends, where you could have 20 or so people. Now we can have 5 or 6. So with getting that facility in-house, we'd be able to be training every day on shift, opposed to only having 5 or 6 people on a weekend.
Okay, thank you.
Okay. What would be the pleasure of the board?
I know for me, I don't know, Josh, if you want to go first or not, I would be willing to do all the requests except for request number 5. I think that's the one that I'm struggling with and I'm not comfortable with.
Okay, Josh?
Yeah, I'm comfortable with that.
Okay, so that would make the request now, I think 186,247 is my math. On Monday.
Mr. Chair, I move to approve and authorize CARES dollars expenditures up to the amount of $187,000 to accommodate for items 1, 2, 3, 4, 6, and 7 as presented by Spokane County Fire District 10 today.
I will second that.
Okay, got a motion and a second. Any more discussion? Seeing none, all in favor say aye.
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 Aye, let the record reflect motion passed unanimously. Thank you very much.
Thank you.
Thank you.
Sir, stay safe. And then, let's see. Next on the, Ms. Brown, I see you joined us this morning.
Yeah, hello.
Yeah, so do you want to describe your request?
Yes, so what I have is request number 1, which is supply and equipment. And the issue we're running into is we're a very small rural fire department. So when this first happened, we only stock a certain amount of supplies, which led us to, I mean, I had to go as far as eBay purchasing certain things. We also have several new firefighters that have not been tested for the N95s. And then the airway devices. Now that we're seeing so many more COVID cases, we're having to stock a lot more of that, which is way out of our budget on what we would normally go. And then the other thing is like our blood pressure cuffs, our stethoscopes, we're having to sanitize those so heavily now that most of those are worn out. And then we don't even have like an accurate thermometer. Something like that is a few $100s, and to stock that on each rig would be a couple thousand, which that's about 5,000 is our normal budget. So for that first part, that's that would be money going towards pretty much the last 10 months of excess that we've had to spend. And then new supplies like the thermometers, pulse oximeters, stethoscopes, new cuffs, and then to send our firefighters to be fit tested.
Okay.
Do you guys have any questions on that one?
No,
Okay.
I'm good. Thank you.
And then request number 2 would be for 3 new suction units. So what we have right now is 2. We have 2 stations, and we're currently trying to get a 3rd in the works. But having 1 per station means unless someone goes there and picks up that rig, that specific rig, we're using handheld suction, which is putting all of our firefighters at high risk of being exposed to COVID, especially because most of the COVID cases are going to be all airway cases. So managing the airway where the droplets are, I mean, we're at high risk. With those suction units, there's plastic and it's all hard material. So the canisters are disposable. So once it's used, we can toss that out and replace that. And they're really easy to disinfect and sanitize. And then with that, we'd have to get replacement batteries and extra canisters to keep those in use. And the 3 would go 1 more per each station and then 1 in the command rig.
okay.
You guys have questions on that one?
Nope, go ahead.
Okay. And then the 3rd one, so what we have right now is a material bag that we keep all of our airway supplies in. And I don't know if you guys have seen them, but it's like a Pelican case, like the hard cases. And so what we're looking to do is go all to those, because instead of dragging the material bags in and out of houses, we would have something like that that's super easy to disinfect, decontaminate, and then we won't be tracking anything from house to house, or it can be sanitized before it's put back in the rig, so we're not carrying all the germs and stuff back into the rig and then back into the station. And right now we don't have any of those. We have just the material bags.
Okay.
And then the 4th one is the Lucas CPR, which I heard a few people put in for. And how that works for us is being a rural fire department, and like right now we actually have 3 firefighters out with COVID. So that really lessens who we have to respond. By putting these 1 in each station and 1 for each apparatus, we would have, it frees up, 1, how many people we actually have to send in, because we don't always know, even if it's not a COVID positive or known COVID, we're pretty much treating everyone like they have it, because if we don't, then we're putting ourselves at risk for getting it too. So when we take these in there for like any sort of respiratory call, because respiratory arrest a lot of times leads to the cardiac arrest, instead of having a group of 4 people in there working on a patient exposing all 4 firefighters, we could send in 2. and this works by itself. And then you could have one person on an airway. And then the other problem is too, is us being so far out there, we're a BLS only. So we have sometimes 45 minutes to an hour before we have an ALS unit there. So this is a long time for us to be exposed to COVID.
Okay.
And then the last one I have is the Zoll Pro AEDs. And these are kind of a newer AED where you can actually compress. There's no pause in between, like checking for pulse, and that you can literally compress the whole way. And so what we have right now is we only have 4 AEDs. So not every rig we have is equipped with an AED, which is huge because if we don't have that on these, especially on COVID patients, when they desat and they go into cardiac arrest, we need that, and we need it, you know, right away. It's not something we can wait, you know, even 15 minutes for another rig to get there, because the chance of survival at that point is slim. So what we're looking to do is put one of those AEDs on each of our rigs. So no matter who's responding, we have that right at our fingertips.
Okay. Any other questions for Kayla? All right. So, Mr. Kearns.
Mr. Chair, I move to approve and authorize the expenditure of CARES dollars up to the amount of $82,000 to facilitate the COVID-related expenses as presented by Spokane County Fire District 5.
I'll second that.
Got a motion and a second. Any more discussion? Seeing none, all in favor say aye.
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 Aye, let the record reflect. Motion passed unanimously. Thank you, Ms. Brown.
Thank you.
So that then gets us to Mr. Phil Champlin, Hub.
Yes, sir. Good morning.
Mornings. You want to describe your request for us a little bit?
Yeah, absolutely. So at
We've
the
got the request.
end of the summer, sorry, I was getting a little bit of feedback. At the end of the summer, we reached out with Central Valley School District and created a partnership that we'd be able to host a site for their learning care centers where students could get support. They could get access to Wi-Fi. It would be a smaller cohort group. And these would be kids with families with first responders or frontline workers, as well as kids that are from a homeless environment as well, could come to the hub and be here for their school day. And so we worked out that we would charge them rent, and they would take care of the staffing and custodial for that program. And so what I've outlined here is our normal rent hours for the studios where the students are at, as well as the court where they can go down and have some activity and break times, and then the additional tables and chairs that we needed to purchase to be able to have the kids spread out in our studios appropriately.
Okay. Any questions for Mr. Chaplin?
No, just, thanks, Phil, for doing this. We've seen this kind of across the area. And how many kids are you averaging? And
So it fluctuates as Central Valley has kids going back to school. So they've ramped up through third grade now. So we're 15 to 20 kids a day. We actually have 31 actively enrolled right now. As the kids do go back, then they consolidate some of their other sites. And we also get kids added as counselors learn of families and students that have kind of fallen through the cracks, or teachers are sharing that these kids aren't in the classroom checking in. We can be a site that parents can bring their kids to, so that we do know that they're logging into the classroom and getting the education that they need.
great, thank you.
Mm-hmm.
I'm good.
Okay, Commissioner Kearns.
Mr. Chair, I move to approve and authorize the expenditure of CARES dollars up to the amount of $41,500 to accommodate the COVID-related expenses as presented by the HUD Learning Center.
I will second that.
Got a motion and a second. Any more discussion? Seeing none, all in favor say aye.
Aye.
Let the record reflect the motion passed unanimously. Thank you, Phil, for all you're doing
Thank you.
out there. Stay safe.
Appreciate it. You too.
Alrighty. Jeff Thomas, are you with us? All right, who's going to be presenting for Frontier Behavioral Health? Are they on the line yet? All right, not seeing anybody yet. Jason Robinson?
You're on mute, Jason.
You're on mute.
Good morning. I'm representing Detention Services.
Okay, go ahead.
We are updating an original request that we made earlier in the season for a portable classroom. The original classroom that we had received bids on sold, and so we had to go out for RFP again. And because these are high demand right now, the only thing that they could come up with was a new unit. So it upped our original request, plus our original request did not include ramps. We thought at the time the ramps were a little high, so we were gonna see if we could find some used ramps. Purchasing went out on an RFP on that also, and we were not able to come up with any ramps too. So our new updated request is for a new unit, new classroom unit. It's just basic, no water services. It's just basically a rectangle with ramps added to that bid. So that upped the amount to the 107 rate. It's a little, that's the ramp cost are worst case scenario. The site is very level, so we will probably not need the level of ramping that the bid included, but we went ahead for worst case scenario, included that cost at the time.
Okay, and this unit is going where?
It'll be out at Geiger Correction Center and be able to help us supplement our programming. Right now with these social distancing and the COVID protocols, it's really limited the amount of participants that we can have actively participating either in the anger management, job skills, or parenting classes, the drug and alcohol counseling, and it also has impacted our ability to move on potentially with the next AGC program session, just because of all the limitations of the COVID.
Okay. Any questions for?
So was,
Oh, I'm
Go
sorry.
ahead, Josh.
I was just going to say, so that there was some dollar amount initially allocated towards this, correct?
Yes.
So I guess what's the difference? What's the delta there that we're approving today then?
The original acquisition, or excuse me, cost was $67,695, and that did not include the ramps or the tax at the time. The new request is for 107, which includes about $10,000 for the new unit and tax, plus the 18,000 for the ramps, which is artificially high at this point, but we're including it at worst case. It's a flat location out at Geiger, so I think that our ramping requirements are going to be under what they predicted.
Okay, so we're
looking at
an additional 40.
39,000.
Okay.
Yes.
About an additional 40.
Yes.
Okay.
Mary?
Yep, I'm good.
All right. So, Mr. Kearns, back to you.
Okay, Mr. Chair, I move to approve and authorize the reallocation of the previously allocated funds to detention services, and an additional with an additional $40,000 of CARES funds to purchase the mobile learning unit building, and additional ramps and other expenses to accommodate for social distancing and other COVID-related expenses with the building.
Okay.
I will second that.
You know what I mean.
Exactly.
If you're not through, we got all morning. No. No, I'm just kidding. Okay, we got a motion and a second. Any discussion? Seeing none, all in favor say aye.
Aye.
Aye. Let the record reflect motion passed unanimously. Thank you, Mr. Robinson.
Thank you for
noticed
supporting
that,
our programs.
You bet. Jeff Thomas, you've joined us. Can you share with us nature of your request for Frontier Behavioral Health?
You bet. And I don't know what's your pleasure. Shall I just kind of canvas kind of some of the context for this request? Would that be a benefit?
Yeah, just kind of summarize what because we all have the written summary given us, but just for the record, you might talk about some of the highlights.
You bet. And before that, I know you're time pressed, but I'm going to take 20 seconds because I'd be remiss if I didn't to say thank you to the board for your ongoing support of mental health and substance use disorder treatment in our community. It's not lost on me or many others, the support that you provide to these vulnerable citizens and the services we provide. So with that, I shared that we had moved many of our employees off-site, as most organizations have. Some of our services have, out of necessity, continue to be face-to-face. Inpatient, of course, crisis services, our co-deployed teams, some of those. One of the things we're finding, and not surprisingly, is despite the tremendous efforts of our staff, it's challenging for all of our clients, even with telephones being provided, smartphones being provided through Medicaid or through HCA funding, some funding from us. Some folks just really do need some face-to-face contact, and some of that we can provide in the community. Some of that we are really feeling we need to be providing on-site increasingly. And so what we're really looking to do is at each of our locations, essentially kind of converting conference rooms, training rooms, rooms that allow for social distancing to provide individual face-to-face services or family services, because all of our on-site clinician offices are just small enough that they don't allow for that distancing. So a lot of this is around having just the equipment to enable us to be furthering the on-site services. One example is with our psychiatric services. We have people prescribing, quite potent psychiatric medications that the best medical practice is to be seeing folks periodically, to be checking their metabolic symptoms and their overall physical health, and we've not been able to do that. We have individuals who are elders who just the technology is challenging for them, individuals with psychosis who the technology just doesn't quite work for them. So these requests in combination would really allow us to be further resuming some very, very limited on-site services only for those clients who are needing them. But the fact that we realize that we're in this for a bit of a marathon, we're really seeing the need to make some of these changes. And then the Evergreen Club one, I just want to call out specifically. There are clubhouses that have been reopening very, very gradually across the nation. Our clubhouse members, and Commissioner Kearns, I'm sure you would appreciate this from your support of them. They are chomping at the bit. We've been able to provide support for them remotely, but they really want to have some way in which we can reopen their clubhouse. But we're so mindful of, with our clients or clubhouse members, if we're going to be providing some on-site services, boy, we want to be really, really cautious about it. So, I mean, those are really the kind of the key components that are behind this request.
Okay, any questions for Mr. Thomas? Very good. Okay, Commissioner Kearns.
All right, Mr. Chair, I move to approve and authorize CARES Act funding expenditures up to the amount of $142,500 to cover the COVID-related expenses as presented today by Frontier Behavioral Health.
I will second that.
Okay, I've got a motion and a second. Any discussion? Seeing none, all in favor say aye.
Aye.
Aye, let the record reflect motion passed unanimously. Thank you, Mr. Thomas, for all that you're doing.
Thanks to all of you. Appreciate it.
Okay, that gets us to specialty mobility services. And Holly, are you there? There you are.
Here. Hello, how is everybody today?
Very good.
So thank you for your time to be able to present regarding the new centralized delivery model for service for Spokane County. So I guess I'll just kind of jump right in and by summarizing why we're here and where we're at as a community. So basically what's led us today is a response to where we've been in the crisis so far. What we've seen is a lot of agencies stepping up to fill the need for food delivery, but a lack of coordination between agencies and sometimes a competitive environment. That's why we're bringing a proposal for a fully democratic system for food delivery. What we've seen is that our current systems have made it so that we haven't been able to publicly tell everybody that these systems and distribution methods are available, and therefore we haven't been able to meet everybody's needs. So in addition to that, each agency has been doing the work of intakes, routing, logistics, and volunteer coordination for this new need for delivery. And we know that that's not a sustainable way to move forward. What has led to this increased need for delivery of food is that in this crisis, there are now homebound populations, people that are susceptible to COVID-19, people with cancer, diabetes, renal failure, and obesity that are now homebound, and that symptomatic people can't access our current food bank systems. And both these symptomatic and susceptible people are unable to use our shared ride services of public and paratransit. We also are seeing a huge need in our community based on economic insecurity, job loss, and lack of income, which has resulted in financial instability to be able to afford gas and car repair in our community. All of those kind of lead to a vision of this being something that also would continue in the community though. We want this to be a program that lives on, because before the crisis, transportation was the second highest unmet need in our community. Before the crisis, we had distribution problems with people living in remote areas and in food deserts in our community, in the most remote regions of Spokane County. Before this, we had individuals with mobility factors receiving meals that were homebound, and those are 1,800 people receiving a hot meal currently in our Spokane community through Meals on Wheels who have unmet nutritional needs beyond that one meal. And we also know that timing issues have prevented access for families who are balancing the life of work world, taking care of their children, and oftentimes their higher education goals. And so we want to support them in not having to be bound by finite service times and days where food banks do operate. We also want to combat boldly the inequities of race in our community, knowing that people in our BIPOC community have a lack of insurance greater than the general population, more increased chronic disease, more stress, increased lack of trust in existing systems, and a lack of healthy lifestyle resources. And for those people, food is medicine, and that is our primary goal, to reach out equitably in this distribution system. So to sum up our project, our vision is for access for all, access as food as a gateway, wherein when they come to us and present their need, often with food being the first need that presents for an individual feeling comfortable in reaching out, that we can get them greater access to information and services that can help them, and that the system would be fully democratized for all food providers, all transportation providers, volunteer coordinators to be able to engage and provide deliverables to the system. So our initial proposal for the month of December is with strong support and infrastructure from the partners of 2-on-1, Jules Helping Hands, Food Fighters, New Hope Resource Center, Spokane Second Harvest, both Meals on Wheels, the Zone Project. But we are finding in our in-depth conversations that this is something that is widely supported in our system and our community of Spokane as a means to help agencies focus on their primary mission. So with that, do you have any questions for me?
Any questions? Yes, Mary.
Yeah, so this, I think, kind of came out of when we were at one of our Tuesday morning meetings. We were hearing that there were still food security issues. And so I had a meeting with the health district with several people to figure out, because I think we've all felt that we're taking care of the food security issues in the dollars that we've been spending already. And so what came about was that this was about transportation. It was about, there's still people that can't get the food because they are in their homes because of their, health issues or different issues, and that there is still some need for coordinating transportation to get meals to them, or to get some groceries or that kind of thing. So so that's kind of how this came about, and I think it's something that if what Holly's saying, if they can make this work now, then it'll help going forward in the future, as this continues. So I think I'm going to be in favor of this to see if this helps them, with that other piece that's missing for food security.
Okay, thank you, Mary. Josh, you have any questions? So the only question I had was the last line item there where you're talking about a survey, community connectors, outreach. Help me understand what this survey accomplishes and how does it relate to everything else that you're trying to get accomplished here?
So it's going to do a couple things. We have a lot of data as to what we postulate the amount of need to be in areas that are urban and rural. And so it's going to help us create a fuller picture of the disparity between resources in those areas. But it's really going to be geared particularly towards our disadvantaged communities. That is the strength of the zone in their access to families. And so the community connectors are going to help to provide some anecdotal evidence that helps us to continue to tell the stories about those systems, particularly those interesting situations where we know we put out tons of food into the community and we're trying to find out, well, what is the access barrier at the end of the day? Okay. And it's also going to help us find out what is the most appropriate food for what people.
Okay, so Carrie, are you still on the line?
Yeah, I sure am.
So are you comfortable that, well, obviously you must be since you've moved this forward, but can you help me understand your thinking about how this qualifies?
The survey, I think it's vital to gain information in this month to also identify, based on COVID, what's been happening to these people if they're stuck in their home. It'll be vital information that'll be gained during this last month that could possibly be used in future, but the actual survey is occurring during the contract period. So it would meet the requirements of CARES on gaining information. I think it's really important, Commissioner, too. We talked about, and Holly, correct me if I'm wrong, it's also about what's lacking out in the unincorporated areas as well, not just within the city. But Absolutely. That was one of the things that was discussed during this committee, is what's occurring in the unincorporated areas, so it directly affects how services would possibly be implemented going forward. But because the survey is occurring during the CARES contract period, it would meet the CARES funding requirements.
Okay, thank you. Appreciate that. Any other questions, either Mary or Josh? Okay, Mr. Kearns.
All right. And Holly, can we make sure we get the results of that survey after it's completed?
Oh, absolutely. Yeah, we're going
All
to
right.
share that very widely.
Okay. All right, Mr. Chair, I move to approve and authorize expenditures of CARES Act dollars up to the amount of $48,302 to cover the COVID-related expenses as presented by Special Mobility Services.
I will second that.
Okay, I've got a motion and a second. Any more discussion? Seeing none, all in favor, say aye.
Aye.
Did you vote, Mary?
Yes.
Oh,
Aye.
okay. Aye. Let the record reflect, motion passed unanimously. Thank you.
Thank you.
So, I think we're up to Lance, L'Oreal, Chaz.
Commissioner, actually, we're on the Y.
Jesse? Oh, okay. Come back to the Y.
Good morning to you all, and thank you for having me. I'm Jesse Zumber. I'm the development director at the YMCA. You also have Alan Lesher on the call, who is our CFO, who I thought would probably be helpful if any additional financial questions pop up. As you guys know, this has been a tough year for the Y. We are obviously most known for our gyms and our workout facilities, which have encountered some unique challenges this year, but more importantly, what the Y is it's Spokane County's oldest nonprofit. We've been on the front lines working through this since day one, when we first started launching our child care programs for essential workers and frontline workers so they could get back out there in the hospitals, on the police force, in the grocery stores, so their children have places to go. Throughout the summer, we've kind of continued that and grown it as we've been allowed to. And now our childcare has really become a key component of what we're doing to help the community. This fall, we launched our Learning Lab and Learning Academies at our YMCA facilities. We have our 4 branches here spread throughout the county, as well as 16 locations where we host childcare programs, mostly outside of the city of Spokane in the Valley districts, up in Meade, out in Riverside, in Cheney, where we partner with Eastern on some things. So really, we've been pushing that and really trying to ensure that kids have access to all the resources they need, as particularly their schools have transitioned to either a fully virtual model or some type of hybrid model with virtual and in-person learning. So our facilities open early, they run late, so kids who either can't be left home alone because their parents are at work, or kids who don't have access to internet at home have somewhere to come and learn virtually throughout the day. In addition, we've run after school programs as well for those kids who are still attending school in person. So again, their parents have somewhere to make sure their children are safe while we work through all this. The Y is obviously having a tough year. We're usually one of the top 50 employers in Spokane County with over 800 employees. Right now, with our facilities running on a very limited capacity, that's been cut substantially, but we're still out there doing the work that we can. I think what we've really seen throughout this pandemic is the work that we do is so vital, both in terms of the childcare and early learning that we provide, but also in terms of the health and wellness opportunities that we provide for our community, as we're looking at the comorbidities and how that's having a negative effect on so many people when they do contract COVID. So we're continuing to work through that. We're providing online courses and online classes for people to work out who either can't leave their home, or now that we're shut down again, it's the only option. But while we were open, it was still very popular with folks who weren't yet comfortable with coming into our facilities, either on a limited basis or who don't have the ability to do so right now because of other things. So all of this has led to, like most places, an increased need for PPE and those types of expenses. We're also, in conjunction with the health department and the State Department of Health, we've requested some funding for some HEPA filters to help provide for our facilities, because we do work with so many vulnerable populations in our buildings, because we do work with children we're trying to make sure that we're ensuring that all the air there is as safe as possible to not spread any of this disease as we're providing these essential services for the kids and for our community. So that's kind of my broad overview, but we're obviously happy to field any questions you all may have.
Okay, any questions, Josh or Mary? Okay, so Mr. Kearns.
Chair, I move to approve and authorize expenditures of CARES dollars up to the amount of $142,300 to cover the COVID-related expenses as presented by the YMCA.
I'll second that.
Okay, I've got a motion and a second. Any more discussion? Seeing none, all in favor say aye.
Aye.
Aye. Let the record reflect the motion passed unanimously. Thank you.
Thank you
Jesse,
all.
your team.
Thank you.
All right. Now that gets us to Chaz. Now let Lance.
Yes, sir. Good morning. Our CFO, John Brown, should also be joining us. I don't know if he's with us yet. We got moved up. We got moved up just a little bit on the agenda. I mean, time frame.
He hasn't joined us yet, so let's see. Well, do you feel comfortable moving forward, or do you want us to take somebody else and then come back to you?
No, he said he would be on. I would rather move forward with him than without him, but he said he would be, we got an email from Gina that said about 10 minutes, so he should be any minute. Let me call him real quick.
So Carol Welts, are you on the line?
I am.
Why don't we go ahead and take Carol, and then we can come back to you, Lance. That way it gives.
Okay. All right, that sounds good.
Is that all right?
Yes, don't want to hold things up.
All right, so Carol, you're up.
Well, good morning. We just said we were going to meet back here Monday morning to see, you wanted to check on some things and regarding the proposal for CARES dollars for the partnering with the utilities. So you didn't ask me to bring back anything specifically new, just that you wanted to look at it. So
right.
Gary
Yes.
has some concerns.
Commissioners, I did reach out to Kathleen per your direction and talk to Kathleen and Tim Crowley about the rental assistance money. One of the questions was, what was the total awarded? It was a $6 million contract. There was about, I believe, $885,000 that Spokane County was awarded for admin, and then I believe 1.8, Carol, was that correct, for admin for SNAP? And then there was $295,000 that was given out for subgrants. HUD requires that subgrants be awarded for outreach to various different groups within the community to make them aware that this funding was available and to assist them in applying for the rental assistance. So all total available for rental assistance was $3.5 million. I also checked with Kathleen and Tim on the utility program. There was $155,353 given out under the GDBC money in round one, and then to workforce, also an additional $214,478 was awarded. So when we last spoke, it was presumed it was around 300,000. So it was just a little under 300,000 that was given out to the utility program. What I did also find out is that most of the programs on utility assistance, because it's HUD money, is that it is based on income. HUD sets the guidelines with regards to the income, and it was only available for the unincorporated areas, and the 12 cities and towns, not the city of Spokane. So that's what I was able to find out since we've last met.
Thank you, Terry. Part of that's because the city of Spokane got their own CDBG money to do it for within the city of Spokane. So that's it's not that they didn't have funds to do it as well. So that I know. So I guess, my thought is still, like looking at this and looking at the proposal is again, because it's COVID related, I'm willing to look at half of it since we know, since we heard last week that, it's about a 50% increase if I'm not mistaken. So that's kind of where I think I'm at on this. And I think it's the kind of thing that if we get down to the end, Carrie, help me understand that if we got to 2 weeks before the end of the year, we could probably still add more to this to help with anything additional.
That would be correct, Commissioner.
Okay.
Well, I would say for on this end and being able to get it out, we'd probably have to have anything we're doing done by December 20th to be able to get it out by the end of the month.
Yeah, and partly, Carrie, just, you'd sent out from GFOA the announcement, or that the senator from Alaska was really hoping to potentially have these dollars extended. I know, so I hate to just spend everything, and if there's a way that we can save some till the end and we can get it back out if we don't see that extension coming.
Commissioner, we have a couple of weeks. That's true. We have about 3 weeks left if it doesn't get extended. So, I think we could probably work with Carol if we needed to increase it. I think your proposal at 50% is probably reasonable. I think Carol's done a incredible amount of work since we last talked to in contacting some of the providers, the utility providers, to be able to address some of the concerns. And, SNAP has been in this business for quite some time, so I believe anything that they put into place would meet federal requirements. They're used to working within the federal guidelines on this. But I think, if you look at, there's been a 50% increase of people not being able to pay their bills because they're out of work. I think that that's a reasonable way to look at this.
Thank you.
Yeah, so for us, again, really the areas that I'm most concerned with is just making sure is that in this funding, the household doesn't have to be income qualified. Like, that's just for our protection, and that, I couldn't guarantee any, that there wouldn't be any duplication of service anywhere because I won't have anybody's name. I'm only going to deal with account numbers, right? So I won't have any names that I could compare anything to. And then you guys had talked about, I had said that for us, it would be a big amount to fund all at one time. You said there's a way that we could get the money having to send that out. So that's doable. I didn't add anything of the cost of doing the business with this, but I think we can get it out for less than $10,000. I think it's more like 6,000, but just to be safe, I'm going to say 10. So it'd be out quick and very affordable with a very light touch.
And so, Carol, it's really going to be up to you're going to basically be giving a lump sum to the utility companies, and it's going to be up to them to ensure that it's getting to the right people within there.
Right. We would send a billing sheet along with the check. We'd probably send it electronic, well, probably electronic, but that would go to the account number, and they would post all of those. We don't have access to post anybody else's stuff. We can post Avista's because we have access to their workbench. So if we qualified those, we could post those payments directly. But there's not such a system on the other utilities within Spokane County. So they would have to do the posting to the accounts. It'd be one check to each utility. I just want them to they'll send over one list, and we'll work with that list, and then we'll send it back and send a check. I mean, it's not a bunch of checks. It's not a bunch of back and forth. We would say the qualifications, whether we decide if it's people who are 60 days past due or 90 days past due. And I don't know if you guys have a feeling on that, what that would be, if you had a preference on that. And then based on you know, if we're not doing the full amount, then it'll have to be, maybe it's, yeah, we'll just have to figure out what the payment across that would be for each household, so that it's equitable, so that, you know, everybody gets the same type of thing without putting a credit on their account. So the only problem, if somebody's, let's say we said 60 days, and somebody's 60 days past due, and we decide the payment to each household is 300 or 400 or whatever it is, and they have less than that, they couldn't get more credit than, they couldn't get a credit on their account. They would only pay the past due, right? So a little bit of variable in there, but so don't want to get too far into the weeds, but
Okay, any other comments or concerns? I'm a little concerned about that the check is going to the utility company and there's no really way to verify, you know, that we're going to get credits to the individuals and that this will actually get passed down and stuff. I agree with Commissioner CUNY about, you know, something less than the 5.5 million. I was leaning closer to $1,250,000 kind of a deal, but if the two of you are comfortable at 2.5 million then, or 2.7 million, then I'm fine to go along with that, but certainly put it out there. So, Commissioner Kearns, what are your thoughts?
can I, just before you go on, you know, we do business every day with the utilities. I mean, that's our business, is energy assistance. And we do business with them 365 days a year, where we send them a check for what we're doing, they post the account, and we don't have trouble. I mean,
okay,
one or two a year where there's something, but it's a good system. It works well. We're used to doing it. So it's not anything anybody's got to learn or anything really different. So it's a pretty effective system that we have set up.
Okay. Commissioner Kearns.
Well, can I, so Carol, you had said last week that the rate of missed payments is about double what it is in sort of a non-pandemic time.
Correct.
Okay. All right. So yeah, no, I was leaning towards that sort of halfway mark.
Okay. So the floor is yours, sir.
All right. Mr. Chair, I move to approve and authorize expenditures of CARES dollars up to $2.75 million to cover the proposal to assist with energy services of COVID arrears as presented by staff.
I'll second that.
Okay, got a motion and a second. Any more discussion? Seeing none, all in favor say aye.
Aye.
Aye, let the record reflect, motion passed unanimously. Thank you, and thank you, Carol.
Thank you. Appreciate you
All
guys.
right, and so now we are back with Mr. Laurel, and we have Mr. Brown joining us. So the floor is yours, gentlemen.
Great. Well, thank you, commissioners, for having us on again. We certainly appreciate the time. You should have hopefully gotten our letter that we sent over, but essentially we're kind of in a little bit of a, like everybody else, obviously, in a little bit of a crisis, but specifically when it comes to testing and community-wide testing, we have seen a surge of about 2 to 3 times the testing that we saw even about a month or two ago on a daily basis. We're doing upwards of about 600 tests a day now, and that is with even some somewhat restricted capacity, just because we do not have the space within our clinics nor the staffing to be able to provide the full demand of testing in our community right now. And so our proposal is really to consolidate our testing efforts, to move testing centrally. We've been in talks with the arena. They do have the space, and obviously with not a lot going on there right now, they are more than willing to allow us to use it. So the plan would be to essentially set up a kind of drive-through parking lot testing site. Our hope is that once we get this up and going, we'll have other community members that will want to join in with us down the road, and we've certainly been in talks with them on that. They also, similar to us, have had a lot of struggles when it comes to supplies, resources, and particularly staffing to be able to staff this. But we're committed to, continuing to try and serve the broader community to the extent we can. And our plan right now is to essentially consolidate our testing sites, move staff that we have from our existing sites over. We're also in the process of hiring essentially as many staff as we can right now to be able to provide extended services and expand what we can do and what we're able to do, so that we can expand hours and expand the number of folks coming through on a daily basis. So that's our plan right now. We will still be offering, particularly for our patients, on kind of an as needed basis, testing within our actual clinics as well. So this central community-based testing site will be really for just anybody and everybody on a drive-up as needed basis. So our proposal right now is really to help fund the daily rate of the arena rental. As you can see, it's not cheap. We know that the CARES Act dollars only run through the end of the year, and we are actively seeking funding and working with other community partners to get funding after December 31.
Okay, and I'm just going to comment that actually the CARES dollars only go through December 30th. So we can't fund the 31st. Carrie's, just correct me if I'm wrong, but the 30th is the cutoff date. For some reason, they had it as the 30th and not the 31st, so we can only do funding through the 30th.
That's correct, Commissioner.
Okay, that sounds good. Well, we will adjust our proposal then down $3,000.
Yeah, sorry about that. I mean, we'd like to. But,
That's okay.
it's one of those things. I just want to make sure for the auditor, it's clear to the 30th, and that's what the dollar amount's for.
Understandable. Yes.
Thank you.
Thank you.
Okay.
So I had a question. When we had the drive-through site out at the fairgrounds, as soon as testing became available at the different clinics and hospitals around town, sort of the utilization of the drive-through facility at the fairgrounds really bottomed out. Like the majority of the folks in the community preferred to go to a clinic or one of their normal provider as opposed to a drive-through facility. Why do you think this would be any different?
Well, particularly because the arena is willing to be very flexible with us for right now. As far as right now, we're seeing just as you know, a huge surge in our community. And so we have completely maxed out our system. Even the other community partners don't have the staffing or supplies to be able to do the testing, the demand that they've had demand for right now. And so the thought would be to get this up and going and hopefully divert a lot of the overwhelming testing needs that we have in our clinics so that we can be providing actual patient care and get back to, doing what we typically should be doing as far as in our clinics rather than having our parking lots inundated with folks coming in for testing. But the arena, the nice thing is the arena is willing to be flexible enough where if we need to either shutter these services in the future, which I don't foresee that happening anytime, soon. I think this demand and surge for testing will be going on for a while, but they're essentially willing to work with us on a day-by-day basis. So if we get to a point where demand really drops off, which I do not think it will this through the end of December for sure. But if we get to that point, we can, essentially divert everything back to our clinics at that point. But our community partners have also, we've heard from all of them. We've been in talks, close talks with particularly Multi-Care and Providence. They are very excited that we're getting this up off the ground and are going to do what they can to help support it going forward. So.
Thank you.
I would echo that. It's the surge and the need for testing that has increased recently, just over the last month or so, 2 months maybe, that has caused just a spike in demand. And we're just not able to meet that with our current model. So we need to expand.
Yep, and I'll just add to that too, that we've really had to, as I mentioned earlier, kind of restrict access to testing just because we don't have the staffing and the services required to meet the full demand and the need. And so our hope is that by adding this central, much more efficient location, we're going to expand our hours to this location, really focus some staffing resources, and hopefully be able to provide even more testing capacity than we do right now. So,
and it's not just for Chaz patients. You want to make that clear. It's for the entire community.
Okay.
Okay, thank you.
So the request now is 72,000 instead of 75. So what would be the pleasure of the board?
Yeah, again with the Chaz requests, I'm going to have to abstain from this. I have a family member that's employed by Chaz, so to avoid any any perceived conflict of interest, I'll abstain from the vote.
Okay.
So, Mr. Chair, I move to approve $72,000 up to $72,000 for the arena rental for testing capabilities for COVID for Chaz Health Centers.
Okay, and I'll second the motion. Any conversation? Seeing none, all in favor say aye. Aye. Let the record reflect that the motion passes 2-0 with Commissioner Kearns recusing himself. And so thank you, folks, for all that you're doing. That then gets us to Cindy Wendell.
thank you, commissioners.
Thank you.
She's not on yet. What's that?
She can't get on.
Okay, so do we have
Commissioners,
calls?
I had one small matter, if I could, before Cindy gets started.
Sure.
The Inland Northwest Farmers Market Association reached out to me, and based on the restrictions that have gone into place and the current spread, they've been losing their volunteers, and so they have to pick up a couple people to pay to put together the boxes of food. So they respectfully are requesting that their contract be increased by $21,617.93 so that they can continue on putting the boxes together.
Okay, any questions, concerns about the request?
Okay. Mr. Chair, move to approve and authorize the expenditures of CARES dollars up to $22,000 to cover the additional COVID-related expenses as presented by Carrie Goodall from the local Farmers Market Association.
I'll second that.
Got a motion and a second. Any more discussion? Seeing none, all in favor say aye.
Aye.
Motion passed unanimously. Thank you.
Thank you.
Thank you, Carrie. So I see we have Miss Wendell and we have Mr. Chad Coles. Mr. What's that? Chad, you're about 5 minutes. Why don't we deal with you first, and then we'll come back with Cindy. So Chad, you're on.
Thank you, commissioners. This is a really short briefing for the board. It concerns an easement on the old Milwaukee property and for the city of Liberty Lake associated with the Henry Road Bridge. They're requesting a 100 by 40 foot approximately easement for stormwater facilities in association with the bridge construction. Have reached out to STA, and they concur that the easement proposed by the city is compatible with future transit needs in the area. Just wanted to brief the board and see if you had any concerns about it. I have some pictures if you'd like to see it, but it's just a block that's 40 by 100.
So, and just as additional information, Katie Allen came to me probably about a week or a month and a half ago, asking if having drainage in the right-of-way would be a problem. And I indicated as long as the drainage easement was over the top of the sewer line, that we wouldn't be building over the sewer line anyway, and there should be plenty of room to be able to accommodate that and stuff. So it sounds like that's what they've been able to accomplish, but that was my response to Katie and the request. Without allowing them to use the right-of-way for drainage, they would have to buy more land, and that would probably put them into a federal structure, which would complicate it even more. So it seemed like a reasonable approach to try and get multiple uses out of the right-of-way. But clearly it's up to the majority of the board whether you'd support that or not. Any questions? Any opposition to allowing them to do an easement for drainage? Okay, go forth and do great things, Chad.
Perfect. Expected on very soon on the consent agenda. Thank you very much.
Thank you. Ms. Wendell, you're on mute.
Good morning. Thank you all for having us here. It's for me, I guess. The rest of us, I just popped off we're still doing some reviews on our hospitality grant. And so very excited to give you a quick update where we're at and why I am back here today. As you may remember, we opened up the application on our hospitality grant relief program prior to the governor mandating additional closures and capacity restrictions. So that was announced one day prior to our original application deadline. We extended that deadline for 48 hours. We were hearing from multiple restaurant owners specifically that were on the bubble of wanting to go through, quote, for them, right, the time and hassle of applying for a grant if they were doing okay. And then with the additional restrictions, a lot of them realized they weren't going to be okay. That this additional restriction, again, they did not know and were very apprehensive about just a 4-week shutdown. So we saw more and more drafts coming in as we got closer to the application deadline. I'm very glad that we kept it open. We saw quite a few. We saw nearly 200 applications between just 2 and 5 o'clock on Monday, and an additional 70 to 80 against applications in the additional 48 hours that we opened it up. So we, with that, we were a little shy under 10 million at the original deadline. When we looked at the amount of requests, the amount of requests was over 10 million a little bit. But when we looked at when we ran some financials in that afternoon, Monday afternoon, about what was, when we ran our financials, what they would qualify for, we were still a little bit under that 10 million. But then when we opened it up and kept it open for the 2 extra days, we saw, like I said, a tremendous amount of additional applications. So now when running some financials, I believe that we are going to have financially eligible applications that are going to be more than $10 million. We, and I sent some information to you earlier about some of these. The original ask amount was around a little over $13 million, to be honest. But again, we've been doing some internal reviews all weekend, trying to figure out how many of these have active Department of Revenue accounts and abide by some of our parameters. And then we also decided to, so you know, for process, that we are going to be giving some of these applicants an opportunity to come back in and clarify some what we call inconsistent information on their applications. So instead of just declining some that didn't answer correctly or whatnot, because of the additional restrictions, we are doubling back down on an effort to do what we can to get their applications in and corrected, which takes a massive amount of time, but our committee decided that we were going to do that because of these additional restrictions. We felt it was so important to try and get funding out to these restaurants and businesses that are just needing it so desperately. So with that in mind, going through all the financials, what I believe is what we will need to, if we wanted to fully fund everybody in the pool that is what we call internally eligible, that they meet the parameters of the program from a basic need as far as Department of Revenue and some other rules that we have on the program. And then if they are financially eligible, I believe the total max will be $11.5 million. So we would need an additional $1.5 million if we wanted to go ahead and fully fund this applicant pool, much like we did an Open Together, and not consider what we do have ready to go as well. If we don't do 11.5 versus 10 million, we have a lottery draw. We have random numbers assigned to each application. So we'll just start with the randomly assigned one and work our way down. And when the money's gone, it'll be gone. So that's the process we have in place right now. If we do get another $1.5 million, what we will do is still use that process because we have it in place, but we know that we have enough money that if any eligible application internally and what we call externally financially qualifies, we'll get funding. So the ask today is for 1.5 million to additionally fund the hospitality program.
So Cindy, a question I have for you is how many businesses are in that first group and how many businesses with this additional 1.5 fund?
So basically, unlike Open Together, when we closed an application period and then we opened up a new one, we didn't do that with this program. We didn't close it and then reopen it. We just extended it. So it is actually all one pool of applicants at this point, 728 applicants.
And how many were in the first one?
In the Open Together program, that included, and this program actually does include nonprofits as well. So that program, we funded on the business side 1,102 applications, and on the nonprofit, we were a little over 1,200 applications in the Open Together program.
And this one we're funding at a higher level than we did in the Open Together.
Yes. So in Open Together, the max was $10,000. This program, the max is $20,000. But we have set in parameters regarding some of our financial equations, regarding their revenue loss, regarding their COVID expenses, and then we also look at their rent, utilities, and payroll. So we have award levels that range anywhere from $1,000, $5,000, $10,000, $15,000, and $20,000. And then, of course, if they request, we ask them to request an amount. If they requested anything different than $20,000, then we look at that request amount, fit it into where it goes with their financials, and we do not fund over their request amount, however, but we figure out where they fit in. That's why we have a requested amount, and then we have a suggested amount in our spreadsheet of what we believe they will qualify for.
Okay, and we don't. Not everyone's at the max, is that?
No.
Okay.
No.
Okay.
I would say, looking at the data from an applicant perspective, on the requested amount, we're probably at 80% the requested, the 20. But if you look at the suggested amount, once we run our initial data, that goes down to probably around 65% to 70%. But we do have quite a few that are going to go ahead and qualify for that $20,000.
Thank you.
Mm-hmm.
Okay, Commissioner Kearns.
I don't have any questions. I just want to point out also the first round, the Open Together, was I mean much broader as far as what businesses could apply, and this is much more narrowly focused to the more harder hit businesses, correct?
Yes, we did 11.3 million that was budgeted in the Open Together program, and that, like, again, funded over 1,200 applications at $10,000 each. And this is more sector specific for sure, into the hospitality industry, and it will be up to $20,000. And the total amount of applications that we'll probably fund, let's see, we have 728 right now. We'll probably be in the high 690s somewhere is my guess.
Okay, very good. So the request is for another 1.5 to cover the balance of the program. So.
Yep. Mr. Chair, I move to approve and authorize an additional $1.5 million to cover the anticipated additional expenses for the hospitality grant program as presented today by Cindy Wendell.
I will second that.
Okay, I've got a motion and a second. Any more conversation? Seeing none. All in favor, say aye.
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 Aye, let the record reflect most passed unanimously.
Thank you, commissioners. We'll get back to work and very excited. The team is going to be very grateful for this. And I know, just reading applications, the last one I read was a family business with 4 kids. And yeah, it's just heartbreaking. So we really appreciate it.
Thank you very much.
Thanks.
So that gets us to miscellaneous items and then pending potential litigation. And to anticipate the pending potential litigation will take a little bit. of time this morning. And I have asked Mr. Maceo to join us, as well as Heather Yakeley and Kathy Allen. And so I've got them teed up for joining us at 11 o'clock. And we can, actually we can we do a conference call with the two of them and then have them call in? Okay, so that we can make that happen. Well, that, or we can also Zoom them and see if they want to join us by Zoom. Okay.
I tried to call Jim a couple minutes ago, so.
Yeah, and have him come over. So do you want to take, so is there any miscellaneous items you want to bring forward at this time, or do we want to just go into executive session? Okay.
And can we take just a couple of minute break so I can hit the restroom and get coffee before?
No, that was my next question is how many of you are like me? So why don't we take about a 10-minute break, and we'll come back at 10:50 and or 10:55, and then while we're taking a break, I'll give instructions to Gina about either Zooming or setting up the Zoom or the phone call, and we'll reconvene at 10:55, and we'll be in executive session for approximately 1 hour. And the executive session will include all three commissioners, our executive management team, joined by Jim Maceo, and also outside legal counsel, Heather Yakeley, and consultant Kathy Allen. So with that, we will reconvene at 10:55.